Good morning. I'm Elisa Z. Thank you for spending this particular Super Bowl Sunday morning here listening to the Sunday edition. I am joined by two wonderful women this morning who I keep confusing with one another because they resemble one another, their haircuts are similar, and they're both here to talk about something very important in the world of our health with BAMF and Henry Ford. See, I looked at the right person for each one of those. They're not even looking like they're proud of me, but I am going to welcome from BAMF, Laurie Placinski. Good morning, Laurie. How are you?
I'm doing fine. Good morning. Thank you for having us here.
My pleasure. And Madelyn Van Tassel with Henry Ford Cancer. Good morning, and thank you for being here.
Good morning. It's such a pleasure to be here with you and your audience.
I'm so glad you're both here. Either one of you jump in first and tell me, bottom line, what is this partnership about and who's going to be helped? Either one of you begin.
I'm happy to start. This is Laurie from BAMF Health. And really the purpose of this partnership spurred from how do we accelerate access to unique type of care? How do we ensure that everyone, irrespective of your financial means, the location which you live, that you are able to not only access this care, but also participate in the advancement of medicine and ensure that you, again, have access to this technology.
Is it specifically cancer care?
So the focus of Theranostics, and that's really the key tagline for this type of medicine.
What's the word?
Theranostics.
Theranostics. T-H?
T-H.
Aeronautics.
It's a combination of the word therapy and diagnostics.
Oh,
and
well,
so
that makes
it's the
perfect
two worlds
sense. Okay, so
converging.
you're channeling your inner Sonny Elliott. Theranostics. Okay.
We are. And with Theranostics, it really looks at how do you utilize radiopharmaceuticals to treat and diagnose. The primary focus right now is cancer, but it is rapidly expanding to other types of disease states such as cardiology, neurology, which is why BAMF is so blessed to have a partner in Henry Ford, not only because of their expertise in cancer care and research, but what they do for the community and serving all the other types of disease states.
This is fascinating. Madelyn, how does this partnership work for Henry Ford? Does this mean that this layer of Theranostics will be available to us through the Henry Ford system?
It does,
Wow.
and I actually have great news for you.
Tell me.
In many ways, we already provide these therapies at Henry Ford Health, and Henry Ford Health has such a history of focus on precision medicine, which is really all about understanding the unique footprint of each individual we care for, and then finding the exact treatment for that exact person's special and unique footprint. So we do that in many ways at Henry Ford Health already, and I can share many examples of that. But in particular, with radiopharmaceutical precision medicine, or in the general term, Theranostics, we're really talking about an opportunity to give precision medicine in a new way.
Okay.
We do it at Henry Ford already. We already offer the FDA-approved therapies.
Okay.
But what's special about our partnership with BAMF is that we have had to sort of retrofit what we do at Henry Ford Health because these therapies are so new and they're so much emerging as the future of care that we've had to kind of work around and retrofit the way we provide this care.
Interesting.
We have comprehensive clinical care at Henry Ford Health. BAMF are experts at this particular type of therapy, top to bottom. And so to me, you put those two things together, and we are bringing a whole new level of care to Detroit and to the state of Michigan on this side of town.
Amazing.
And from a global perspective, so this is Laurie from BAMF, if I may, I would say that really enhancing access and also having these two global institutions come together,
Yes.
It's not just what can we do to serve all Michiganders, it's really further positioning Michigan as a global destination for research in radiopharmaceutical advancement and care.
Every piece of this is critical. And from what I see and what I read, and sadly what I experienced with my mom less than a year ago, we are getting better at honing in, and immunotherapies are able to help a lot of people and things like that. One thing I found, and if I'm asking something outside of the purview of your wheelhouse, feel free to tell me. But my mom a year ago was diagnosed with stage 4 cancer. She felt great her entire life, and then at 94 she had a pain. We went into the hospital, and the doctor came in and said, you have stage 4 cancer. They suggested 6 to 8 weeks left, which is exactly what we got from her, with her. But one piece that was so troublesome to me was the wait time to find out whether or not she qualified for immunotherapy because of the backups, the backlogs. And as it turned out, she was, but it took 6 weeks to find that out. And at that point, it really was too late. Will this help in that regard, Laurie?
This absolutely will help. So when we touch on the diagnostic side, it's using that precision technology and precision medicine to say, let's bring forth the best scanners and the best tools so that when your loved ones, their providers, they're armed with information, and so they can look at then what the type of disease state is, how it's progressed, what is the right treatment. And so it's really about true precision technology, precision medicine, and informed care.
What does it look like? What does the facility look like? What does the apparatus look like? Because it's pretty substantial, isn't it?
In order to do this type of advancement, you have to have a facility that's built specifically to support this. So what we're doing in collaboration as Henry Ford and BAMF is building a 45,000 square foot comprehensive theranostics platform.
Wow.
Right downtown in the Gratiot area.
Great.
And with that, there'll be a full production radiopharmacy, a full production molecular imaging center, a molecular therapy center, and I think most importantly, knitted across all of those is an enhanced radioligand clinical trial platform.
And that is, critical is the word, right, Madelyn? We are looking at so many people who would be eligible for clinical trials. We're losing funding. We need clinical trials in order to save people's lives. This has to be just, it has to make you, in a sad way, but giddily happy that we're going to be able to offer here in Metro Detroit better diagnostics, better therapies, more targeted in all of the above. And let's also say, boost the Metro Detroit economy with construction and hiring people and everything, right?
Absolutely. And I think you hit the nail on the head. This makes us proud. It makes us proud to provide better access to care to people in this community, to set a national model for what this care should be. It's the first of its kind of this type of a partnership. Amazing. So I see this as really all about innovation. And again, Henry Ford has been about innovation since the start of Henry Ford Health, and there's innovation in many ways. So we've talked a little bit about how the Comprehensive Theranostics Center will deliver innovation in the actual care experience for the patient, which is absolutely premier. And it's what we would all want for our own friends and family.
Yes.
And it's our neighbors, and it's the ones in our communities that we'll be caring for, and we're confident and proud to be able to deliver that level of care. It's also innovation in drug development. We're not interested in just delivering what's already available.
Right.
We want to shape the future of this therapy, and we know that it is the future of cancer care, of neurologic care, of cardiovascular care. So we're interested in being part of that drug development. It's also innovation in the economy and workforce development, which is something that people don't often think about right away. Right. But we have an obligation as an organization. We're the largest employer in the state of Michigan.
Right. With
BAMF, we can really set the track for developing the specialized workforce needed now and in the future for these therapies as it grows across the globe. And then just to end again with a business model, it's very exciting to be the first of its kind, bringing together a large integrated health system with a unique, innovative company like BAMF and coming together to really solve this and set the national model.
Yes, I like when things come from here first, because we are innovators. We do have a patent office in Detroit. So much emanates from the epicenter of Detroit and southeastern Michigan, and this is Detroit proper even. What kind of training, what kind of education track should someone be on? Is it a radiology? Is it nursing? Is it medical? Is it all of the above? What do we do? How do we get ready?
I'm happy to take that first, Madelyn, if that's
Go
all
ahead
right.
And start, yeah.
So really, it's a new way of medicine, and it's pulling from previously established different service lines. So it does involve radiology, it involves oncology, it involves cardiology, neurology, but what we like to say, it's a new definition of medicine. So we've kind of coined the term theranostician.
Okay.
So what is the provider of tomorrow that's needed to be able to support this? I'll also say within the radiopharmacy, it's really looking at what that that workflow and pipeline needs to be.
Sure.
And it's the partnerships that both Henry Ford and BAMF have forged with academic institutions. And so that commitment is the talent that's needed for tomorrow, we have to invest in how we train them today.
Yes.
So it's looking at purposeful enhanced curriculum. It's looking at what's needed, and again, being on that front edge, that bleeding edge, to be able to push that forward.
Did you have something to add, Madelyn? You had a look on your face.
Oh,
it was a nice look.
Thank you. Just to echo what Laurie shared, at Henry Ford Health, education is a part of our tripart mission around clinical care,
Right.
research, and education. So it's very important to us to be able to be part of shaping that future. That's the first time I've heard your unique term that you shared, but I love it.
I like that a
And
lot.
we'll be establishing new fellowships for physician training that don't exist today. We'll be establishing new curriculum for nuclear medicine technicians, for nurses, for other clinical staff.
So exciting.
And so it's very exciting, and it provides an opportunity not only to partner together between Henry Ford and BAMF, but also to partner with universities around our state. As you know, Henry Ford has a partnership with Michigan State University,
Yes.
but more broadly, really setting a platform for engagement at a new level.
And if I may add into that, I think that's exactly what BAMF has seen as we've established some relationships for a state university. And we know Wayne State University, there's a lot of universities and public universities
Yes.
that very much are looking for that opportunity to attract and to maintain talent in Michigan, and we want that as well. And this center gives us not only the platform to help educate, but the platform, again, for them to be able to do hands-on learning.
When will this be available here? When does construction start? How long do we have to wait? And what about insurance? Because you know that's everybody's big question.
Madelyn, I'm happy to talk about the building itself, and I'd love for you to talk about where care can be accessed now as we wait for the building to open up.
Okay.
So right now we are eyeing a late 2027 to be able to open the doors for patient care.
That's fast.
Our teams have been working rapidly, not only with the two of each other, but also with Bedrock Development, who will be building out that building. I think the commitment we've all made is we can't go fast enough.
Yes.
So we're continuously looking for ways to get the doors open sooner to ensure that we can broaden access. But you don't have to wait till 2027 to access this care.
Thank you, Laurie. Just again, these therapies are available here in Detroit. Henry Ford Health offers them downtown at our cancer pavilion for prostate cancer and neuroendocrine cancer. But our pathway forward between now and then also includes working together to make sure that we focus on that future and develop the future model of this care.
And again, what about insurance? Will it be covered? Do we not know yet? We need to hear it from your. They're both nodding their head yes. So somebody say words.
Yes, it is. It is covered, and which is wonderful. So access
huge.
is there, local access is there, and again, the future of this therapy will be here for the communities that we serve.
So important. We have about 2 minutes left. I'm going to turn it over to you, ladies. Let's give some websites and any parting words for us or predictions for today's ball game.
I think parting words would be just if you are interested in learning more, or you have a loved one that is interested in seeing if they qualify or can have access to this type of care, please feel free to reach out to bamfhealth.com or
if anyone has more interest in learning about Henry Ford Health and what's offered today, it's henryford.com. And just want to wrap with maybe a final comment around how the Comprehensive Theranostics Center in Detroit is the tangible example of the partnership.
Right.
But I think we both share in the belief that the strategic partnership is really much more broad than that, and it is about future development of radiopharmaceutical precision medicine. It's about innovation, and it really is about the value of partnering,
Right.
because no one organization can do everything on their own.
Exactly.
And so when we come together with aligned mission and aligned vision, we can do anything.
And I would say that's the biggest impact. And to kind of knit that all together, the reason that both organizations, when we first met, agreed to partner is because we put the patient, we put the human being first. And so the whole reason we're doing this is to give people access to more birthdays, better quality of life, additional opportunities. And so that's our joint commitment to the community. And again, really look forward to not only the partnership that's activated now, but being able to open the doors and to treat and to see more people.
Boy, I can tell you both believe in what you do, and I love to see that. That really is. How long, and we'll close in a moment, but how long have you been with Henry Ford Health?
I've
Madelyn?
had the pleasure of working for Henry Ford Health for 16 years.
Wow, and she only looks like she's 27. Laurie?
Well, she started when she was 15.
There you
She
go.
left that part out. I've had the pleasure of working with BAMF Health for almost 6 years and then worked with them 2 years prior consulting to help with the startup.
Well, I'm grateful to both of you. Thank you very much for being here and for expanding the optimism in our future. Thank you both.
Thank you.
Thank you.
And thanks to each and every one of you for spending this Sunday morning here with us. I'm Elisa Z. You're listening to the Sunday Edition.